Good morning, everyone, and welcome to the 2021 Epilepsy Awareness Day. My name is Natalya Kan Tran. I am the Epilepsy Nurse Coordinator at the West Los Angeles VA, which is part of the VA Greater Los Angeles Healthcare System. I welcome you to our department here, and we're so excited to have you join. I will go ahead and share my slides now. So the schedule of events for the next 2 days, today, Monday, the 8th of November, I will be starting us off with the VA Epilepsy Services. And we have a full schedule of events the rest of the day. We do have an Ask the Pharmacist event and another one with autoimmune epilepsy, anti-seizure medications and their side effects, and lastly, new anti-seizure medications. Tomorrow on November 9th, we also have quite a few talks for you. The first one being post-traumatic epilepsy, then advances in surgical treatment of epilepsy, followed by epilepsy diagnosis and treatment decisions. We have another Ask the Pharmacist booth, a virtual booth, and the last talk of the day for tomorrow will be on cannabidiol. So the goal of my talk today is to share what VA Epilepsy Services we have available for veterans, but also to share some resources that you may find useful. Now, epilepsy is the fourth most common neurological condition. There are 65 million people who have epilepsy worldwide, and about 3.4 million Americans have epilepsy. There are 150,000 new cases diagnosed in the US annually, and 1 in 10 people have had a seizure. With that, approximately 1 in 26 people in the US will develop epilepsy in their lifetime. This quote from the World Health Organization is quite telling. It does say epilepsy is the most common serious brain disorder worldwide. It has no age, racial, social class, national, or geographic boundaries. So anyone with a brain can have a seizure. And with those statistics, I would like to point back to why we're all here today, and that's to raise awareness about epilepsy, and specifically for us, for veterans with epilepsy. I will not go over all the information about that, as I just showed you the full schedule of events that we have coming up for the next 2 days. I do want to share a little bit about the Epilepsy Centers of Excellence. They were actually founded in 2008 by the Department of Veteran Affairs, and it established 16 sites to form 4 regional centers. Now, currently we actually have 17 sites, and that may change over time, but as you could see, the 4 regions do remain the same, and they're actually consortium sites too, in addition to what you see on the map here. The mission statement of the Epilepsy Centers of Excellence is to improve the health and well-being of veteran patients with epilepsy and other seizure disorders through the integration of clinical care, outreach, research, and education. As you can see the names of each site, and you can be referred depending on the region that you're in. Now, the ECOE stands for VA Epilepsy Centers of Excellence. It seeks to provide high quality clinical care through the state-of-the-art diagnostic and therapeutic services. We also seek to promote outreach and educational efforts for our partners and physicians to further understand the understanding of this chronic condition. I've also included the regional sites and contacts, so you can look at the locations as well as the telephone number. Generally, you could be referred by seeing your primary care provider, and if they need to refer you to first see neurology or see the epilepsy center directly, they can make that referral on your behalf. But you can also contact the site depending on where you're located, and discuss how you can be referred and ask questions too. Now, about the VA Epilepsy Centers of Excellence, who are the team members? This is not all inclusive, but of course you have the epileptologists who are trained neurologists in epilepsy. Sometimes some centers may also have advanced practice providers in epilepsy, such as physician assistants or nurse practitioners, neurosurgeons, neuropsychologists, neurology pharmacists, neuroradiologists, EEG technologists, epilepsy nurses, such as myself. I'm the coordinator epilepsy nurse. And there are also, of course, the epilepsy monitoring unit nurses in the centers. The services provided include outpatient specialty epilepsy clinics, telemedicine, especially now. There's definitely much more involved in that. You can have home telehealth or even come to a smaller site in your location and do a telemedicine visit from there. We have inpatient video EEG monitoring, or also called the Epilepsy Monitoring Unit. At the Los Angeles site, we have phase 1, which is the non-invasive, the most common one where the electrodes are placed on your scalp. But we also have phase 2, which is the more invasive, the intracranial recording for patients who need more advanced studies and also for surgical interventions. We do have those advanced diagnostic studies that are typically done for patients who are undergoing the pre-surgical workup. And surgical interventions include epilepsy surgery, which is resection typically, but it does involve many other options, and it is specialized depending on the patient's case. And we also have vagus nerve stimulation, responsive neurostimulation, and deep brain stimulation. So we do offer a variety of services depending on the patient's need. So this is very general information. I just wanted to share what you can expect or what you can have depending on each center. It may vary. And next, I actually wanted to share with you the website, which could be very helpful to find additional resources. So as mentioned, my goal for this talk today is mostly to give you an overview of what the VA can provide for veterans with epilepsy, and also share some resources and things you can find online as well. So let me pause here. And I will go ahead and share the website. One moment. Okay, so to orient you to the website, to start, if you wanted to learn just more about what I just talked about, which is the mission and how they were started, you could find that on the homepage. If you want to read more about what are seizures and what is the first aid or causes or diagnosis, the treatment options, you have a very brief overview here on this site. But mainly, if you want to read more about the ECOEs or the epilepsy centers, you can review this site, and we even have annual reports for each year. Now, for epilepsy care near you, it is the map that I just shared, but it also includes consortium sites. And as I mentioned, there is a network of sites in each region, and you can be referred. So for instance, we are the Los Angeles one right here, the red star as one of the centers, but we do have consortium sites that we work very closely with. So they're epilepsy trained providers at Loma Linda and Long Beach, and we do keep close touch with them. Now, for you to find it, you can look at each region. I mentioned there are 4 regions here, and there are phone numbers here if you want to call directly, or you can again talk to your primary care provider for a referral. And next, the patient education tab here. The link will take you to all the different resources that have been worked on over the years. It is not all inclusive, but you can find caregiver webinars for patients and caregivers. And these are recorded from the past and previous years that we've had. There may be some that are missing, but you're welcome to request to be added to the email blast. And when there's a new schedule, these typically happen every month or every other month, depending on the availability, and they are virtual as well. But you can watch some of them that are available online here. So this is a great resource if you have a specific topic you're interested in. As you could see, there's topics about memory, self-management, women's issues, post-stroke, and so on. And the other link, these were actually recorded on each site. These are the Veterans in Epilepsy basic training. So if you go back to the site, you can see there are links. You can go to each individual YouTube link. And like I said, it was recorded at the actual epilepsy centers, different sites. The ones we had done was the medications at the Los Angeles site. We recorded that here. And if you click on that link, you'll be taken to this playlist. And some of the topics include TBI or traumatic brain injury, diagnosis, psychosocial issues, medications, seizure first aid. The introduction looks like it's not really in order, but this would probably be first. It also talks about psychogenic non-epileptic seizures, as you could see with Dr. Curler-Franz here. There are surgical interventions and women's issues. So this is a playlist of YouTube videos that you can find online, or you could do that through the website. Also here you could find links, they're PDFs. You can also request this as a hard copy, but if you like, you can also reference everything virtually. So this is a self-management guide that was put together by the nursing work group. There are other quick series booklets available here. A brochure on psychogenic non-epileptic seizures can be found here, as well as previous video presentations. These could be older, but again, over the years that have been recorded. So this is the patient education tab, but there is also provider education. And I found over the years at the Epilepsy Awareness Days, sometimes some patients or caregivers or even some family friends do want to actually get access to this. So for instance, this epilepsy manual for clinicians, even though it is for clinicians, you are more than welcome to take a look at this. This was put together by our providers here in the epilepsy centers. There's an edition number 1 from 2014, as well as an updated one from 2018. So if you click on this, you can get a PDF. It's quite a big file, but we do have books of this if you did want it to be mailed to you. Again, this is for clinicians. There's an anti-epileptic drug pocket card, but you can also take a look at this. And there are previously recorded talks if you did want to listen in as well. Lastly, the nursing education tab under education here. This is by the nursing work group, which I'm one of the chairs for. And we do include a network of multiple sites there as well, not just the centers, but also consortium and other sites, and anyone's welcome to join. My co-chair Tracy, for instance, is out of the Seattle VA. And so these are more resources for the nursing staff or the coordinators who may be interested in different resources for them. So this includes safety in the epilepsy monitoring unit videos and PowerPoints and quizzes and different competencies. Now, as I said, these are more geared towards providers and nurses, but the patient education tab does have quite a lot. There is also a patient resource home. If you click on here, and you can find additional links for your information. Let me stop pausing, stop sharing here, and I will go back to PowerPoint. One moment, please. Okay, so that's the website for you. I hope that was helpful. I wanted to just orient you to see all that you can find there. Now, if you do belong to this region, if you're calling from locally. I did want to provide some very common and useful phone numbers if you are already a patient. This is a 24-hour telecare nurse advice line for veterans who are registered in the West Los Angeles, San Diego, Loma Linda, Las Vegas, and Long Beach. There is also a 24/7 Veterans Crisis Line, and it's for all locations. And a very common question is for pharmacy, if you need to refill your medications. This is the one for Greater Los Angeles. And I believe this will all be recorded and available online for those to review in case you need to reference back to any of these. So some additional epilepsy resources here. This is the website that we just talked about. This is the patient education tab, the Epilepsy Foundation of Greater Los Angeles here. And I do know that I just learned you can actually request those alert bracelets for seizures there by contacting them. There's also the link to the Epilepsy Society, American Epilepsy Society, and the YouTube educational videos that I showed you a playlist of. The next few slides are also reference slides, and this is more to have some site to refer back to in case you had any specific questions. So for instance, this page includes what kind of benefits and how to get started on that. So if you're not yet part of the system, but you're interested, you can follow these links or even call these numbers to apply and see if you're eligible. This is the link, for instance, how to apply. Once you are a patient, we also have a very useful application. It's called the My Healthy Vet. It's an online health record system. You can reorder your medications, see your appointments, send secure messages through there. There is also one site here for women veterans health program and rural health. And then for the next slide, I have some information for mental health support and some links as well. For Veteran Center information, you can also follow these phone numbers and links. For the Benefits Administration or VBA, there are also additional things here. Oops, I believe this is repeating itself. I apologize. And we have some post 9/11 GI Bill benefits, pension, disability, and insurance contacts and website links. So this is the end of my presentation. As mentioned throughout, you can request hard copy educational materials to be mailed. You can send it to the ecoe@va.gov. We do currently have a transition in staff, but you can reach out there, or you can reach out to our West LA site if you joined this talk and you had any specific questions. Just as a reminder, if you have not yet registered, but you're interested in becoming a patient, you do need to check your eligibility and apply. If you are a veteran patient already and being seen at the VA, and you're interested in being evaluated for possible seizures or seizures in epilepsy, you can talk to your primary care provider, or you can contact the site directly, as I mentioned. And they can send a inter-facility request even. So even if you're not in the same city as Los Angeles, for instance, you can definitely come to see us or whoever is closest to you in the region. And you're welcome to contact us for any questions. And now I will open the floor for any questions you may have. Does anyone have any questions for me? Thank you. And if you'd like, I can actually unmute you if you have any questions to ask. I believe you can unmute yourself too. Thank you for joining. And again, have a wonderful rest of the Epilepsy Awareness Day. Our next talk will be, let's take a look. Our next talk is at 11 o'clock, and it will be by Dr. Hyojin Seo, who is a neurology pharmacist, as well as Dr. Riley Johnson. It will be an Ask the Pharmacist booth where you can have a chance to ask questions, but also look at some informational videos from the past. Thank you. Hello, everyone, again. Thank you for joining us. The next part on our schedule is to go over the Ask the Pharmacist booth. We will have a few videos for you for Epilepsy Awareness Day, followed by Jin and Riley, who will be available to answer your questions. There are neurology pharmacists. So please bear with me as I go ahead and share the videos with you.
Hi, my name is Dr. Emily Boychuk. I worked in retail pharmacy as both a pharmacy technician and then a licensed pharmacist for several years, and now I work at the VA as a clinical pharmacist. I strongly encourage patients to have a good relationship with their pharmacist and don't be afraid to ask questions. Your pharmacist wants to make sure that you are healthy and safe. I'd like to review the process of how they do that and what you can expect when you bring your prescription to a community pharmacy.
I'm sorry, let's give it 1 moment. I preloaded the videos, but it looks like there is a little bit of a lag. Second.
First, the pharmacist is going to review the prescription and make sure it is safe for the patient. They will check that the dosage prescribed and treatment makes sense. And they will review the information that they have available about the patient, such as allergies or interactions with other medications that the patient currently takes. The pharmacist may need to ask the patient a few questions to make sure that the
I'm sorry, let's try this again.
prescription is safe.
Hello, thank you for joining us back at the VA in the Epilepsy Centers of Excellence. Next on our program, we have Ask the Pharmacist. We'll have some videos for you for Epilepsy Awareness Day, followed by some time for questions and answers with our neurology pharmacists, Dr. Jin and Dr. Riley. I'm going to go ahead and share my screen with the videos. Can you see it?
Hi, my name is Dr. Emily Boychuk. I worked in retail pharmacy as both a pharmacy technician and then a licensed pharmacist for several years, and now I work at the VA as a clinical pharmacist. I strongly encourage patients to have a good relationship with their pharmacist and don't be afraid to ask questions. Your pharmacist wants to make sure that you are healthy and safe. I'd like to review the process of how they do that and what you can expect when you bring your prescription to a community pharmacy.
Could you guys see the video? Yeah, we saw it.
Yeah, I could see it and it was running really smooth.
Thank you for joining us. Next in our program is Ask the Pharmacist, and we will have a few videos for you for Epilepsy Awareness Day, followed by question and answers, Q&A session with Dr. Jin and Dr. Riley for our neurology pharmacists here at the West Los Angeles VA. One moment. It's not allowing me to share the screen. Here we go.
Hi, my name is Dr. Emily Boychuk. I worked in retail pharmacy as both a pharmacy technician and then a licensed pharmacist for several years, and now I work with the VA as a clinical pharmacist. I strongly encourage patients to have a good relationship with their pharmacist and don't be afraid to ask questions. Your pharmacist wants to make sure that you are healthy and safe. I'd like to review the process of how they do that and what you can expect when you bring your prescription to a community pharmacy. First, the pharmacist is going to review the prescription and make sure it is safe for the patient. They will check that the dosage prescribed and treatment makes sense. And they will review the information that they have available about the patient, such as allergies or interactions with other medications that the patient currently takes. The pharmacist may need to ask the patient a few questions to make sure that the prescription is safe. Some examples are the patient's weight, allergies, or pregnancy status. Depending on the medication, this information may be critical to the safety of the drug. The pharmacist might also contact the prescriber's office to clarify information on the prescription and may even discuss lab results or monitoring parameters to make sure it is safe and effective. Second, the pharmacy team is going to process the prescription through the patient's insurance plan. The patient can help make this process run smoothly by having their most current insurance card available, as the billing information often changes with each new year or new plan. Patients should talk to the pharmacy team if they have any special billing requests, such as billing a secondary insurance plan, a spouse's insurance plan, or a coupon card, to name a few examples. The insurance plan might request additional information before they approve coverage of the medication. One common example of this is a prior authorization request. In a prior authorization request, the prescriber needs to send the insurance plan information about why this medication is the best course of therapy. I encourage patients to communicate with both the pharmacist and the healthcare provider on the status of these insurance requests. If the insurance plan will not cover a prescribed medication, perhaps even after providing the requested information to the insurance plan, the pharmacist can help work with the prescriber to discuss alternative options that may be covered by the insurance plan. The pharmacist keeps the patient informed in the billing process, especially if there are any delays. And the pharmacist discusses with the patient if the prescriber recommended or changed the prescription to an alternative covered option. Third, the pharmacy team fills the prescription. The most common scenario is the pharmacy has the medication in stock and is able to fill the prescription that same day. Pharmacies try to stock their inventory in anticipation of what the community is most commonly prescribing. That being said, specialty products or brand name products may not be readily available, and the pharmacy team may need to order these specific to patient requests. If something needs to be ordered, ask the pharmacy team if they have information on the anticipated time frame. It may take a few days to ship or potentially longer if the medication is back ordered. The pharmacist can help patients with their options. They may be able to transfer the prescription to another pharmacy in the area that has the medication in stock, or they may be able to help coordinate with the prescriber if an alternative product may be appropriate in the case of an extended back order. If a patient knows they will be refilling a special order item, it is helpful to talk with the pharmacy team ahead of the next order so that they can plan to have it in stock. My number one tip for patients is to look at your medication before you leave the pharmacy. Open the bag and check if the medication looks the same as last time. Is this the prescription you were expecting? Pharmacies are often stocked with multiple generic manufacturers of the same drug. Therefore, the same medication may be dispensed, but it looks different, a different shape, size, or color. The generic medications are approved based on the equivalency to the brand name product. For seizure medications in particular, there are some drugs with narrow therapeutic ranges. Therefore, a change from one generic to another generic may result in a change of the therapeutic drug levels. If a patient notices their seizure medication looks different than last time, talk to the pharmacist about the change. Ask them if this is a medication with a narrow therapeutic range, and discuss if the previous generic is still available. Checking your pills before you leave the pharmacy will help make your trip run smoothly. There are federal regulations and state laws prohibiting a pharmacist from returning a medication once it has left the pharmacy. This is for patient safety. The pharmacist can no longer guarantee the drug has not been contaminated or tampered with after it leaves. Checking the pills before leaving will ensure all questions are addressed, and if any changes need to be made, they can make those changes. Having a good relationship with your pharmacist and good communication can help you navigate the insurance process and stay on track with refills. For any prescription questions, you can always ask your pharmacist. Thank you for listening to my presentation. And if you have any questions about the prescription process, please reach out to your
Okay, thank you. We have a couple more.
Hello everyone. Welcome to Epilepsy Awareness Day. I'm Dr. Grace Seema, a mental health critical pharmacy specialist at VA Greater Los Angeles. Hello everyone. Welcome to Epilepsy Awareness Day. I'm Dr. Grace Seema, a mental health critical pharmacy specialist at VA Greater Los Angeles Healthcare System. We'd like to share with you the relationship between mental health, epilepsy, and anti-seizure medications. Studies show that about 20 to 30% of people with epilepsy also have some type of mental health challenge, such as depression, anxiety, panic or fear, irritability or aggression, poor frustration tolerance, or behavioral disorders in children. People with epilepsy and coexisting mental health conditions present a more complex situation that requires a more complex assessment and treatment. These conditions can occur independent of the timing of the seizure, or they can happen 1 to 3 days before or 1 to 5 days after a seizure onset. Therefore, it is important to keep a record to share with your neurologist, not only when the seizures occur, but also when any of these symptoms occur with respect to the seizure onset. This will help your physician tailor your medication regimen to best fit your needs and provide the best treatment for you.
The timing of mental health symptoms with respect to seizures onset matters because the treatment will be different for each case. If the symptoms occur before the seizure onset, the treatment may require medications for psychiatric symptoms or psychotherapy. If the symptoms occur after the seizure onset, treatment will require the achievement of a seizure-free state. If the symptoms are caused by an anti-seizure medication, this will require a change in treatment. The main goal for epilepsy treatment should be to control and ideally get rid of seizures. At the same time, it is important to pay attention to how the seizure medications make you feel and how they affect your daily life. Sometimes a medication works well to control seizures, but it may affect your mood. For example, vigabatrin may cause depression. However, lamotrigine, valproic acid divalproex, or carbamazepine may elevate mood or have an antidepressant effect. On the other hand, levetiracetam, pregabalin, gabapentin, perampanel, rivaroxatam, and cannabidiol may make you more irritable and anxious. You want to share how you feel with your doctor. You may change medications to find one that doesn't cause the side effects.
It is very important that when a patient is evaluated for epilepsy, the neurologist has a comprehensive mental health history of that patient, including his or her family history. This is where the patient and family can contribute by providing a thorough psychiatric history and any new or ongoing symptoms to healthcare professionals. People with previous mental health history are at increased risk of developing psychiatric adverse effects when exposed to certain medications. In this case, the provider may choose an anti-seizure medication that does not worsen the mental health condition. People with pre-existing anxiety disorders have less tolerance to anti-seizure medications. The lack of tolerance to their anti-seizure treatment is mainly due to their pre-existing mental health conditions such as the anxiety disorder and not due to the anti-seizure medications themselves. Many people with epilepsy have coexisting mental health conditions like mood and anxiety disorders or psychosis. Therefore, in addition to their anti-seizure medications, they may also be receiving treatment with antidepressants, anxiolytics, or antipsychotics. The addition of these medications increases the risk of drug-drug interactions and drug-disease interactions. Such interactions are common and need to be monitored. Some anti-seizure medications can lower or raise the levels of other medications in your blood. For example, valproic acid or divalproex may increase the blood levels of a variety of drugs like lorazepam or antidepressants like paroxetine, amitriptyline, and nortriptyline. Another example, fluoxetine and fluoxamine may increase the blood level of phenytoin and valproic acid or divalproex, and possibly of clobazam, lacosamide, or primidone. An example of a drug-disease interaction is bupropion, an antidepressant, when given at doses above 600 mg daily, will increase the risk of seizures. If you have been taking the same combination of medications for a long time and are doing well, you probably don't need to be too concerned. However, if you're just starting one of the medications or are experiencing bothersome side effects, check with your doctor. It is imperative that you also notify your physician and your pharmacist before you start any over-the-counter medications, including dietary supplements or herbal remedies. This is important because some of them may decrease efficacy of your anti-seizure medications and increase your risk of seizures, even if you stick to your normal dose. For example, St. John's wort, an herbal medicine used to treat depression, can lower the levels of phenytoin and carbamazepine in the blood, which could result in potentially decreasing their effect in treating your seizures. The changes in serum levels can also exaggerate the effects of seizure medications, including unwanted harmful side effects. An example is CBD oil, a cannabinoid most commonly used for insomnia, anxiety, and chronic pain. It's also known to increase serum levels of topiramate, rufinamide, and zonisamide, which could lead to harmful side effects. Therefore, it is imperative that you always consult with your physician before you start any other medications or supplements, or if you experience any bothersome side effects. It is critical that you follow the medication regimen prescribed by your physician and do not stop your treatment without discussing with your provider. If you don't feel well or experience bothersome side effects, please notify your doctor immediately. Non-adherence to anti-seizure medications is associated with increased risk of mortality, hospitalizations, and higher risk of injury. I also need to mention that anti-seizure medications have a serious warning of possibly increasing the risk of depression, suicidal thoughts, or behaviors. Your physician will go over this with you in one of your initial visits. In conclusion, we recommend that you pay attention to any mental health symptoms that you may experience and keep a record of them. Also, notify your physicians and pharmacists of any change in prescription or over-the-counter medications. This will help them to optimize your treatment and minimize undesirable side effects.
Thank you. And then the last video, let me go ahead and share the last link for everyone.
Hello everyone, my name is Jen and I'm a clinical pharmacy specialist in neurology at the VA Greater Los Angeles Healthcare System. And today I want to talk to you about the do's and don'ts of anti-seizure medications. The main mode of treatment for epilepsy are medications called anti-seizure medications or ASMs. Currently, there are over 25 ASMs available, and many people with epilepsy may take 2 or more ASMs to control their seizures. Taking your medications correctly and on time is very critical for successful treatment. Because there are so many different medications out there with many different properties, I want to go over some important do's and don'ts of ASMs. Here is a basic list of do's for your medications. First, know the possible side effects of your medications. Remember that some side effects may be mild, while others are more rare and serious. In the event that you experience a serious side effect, you're able to recognize it and seek medical attention if needed. For example, many ASMs can cause some mild drowsiness, and with time they go away. However, some ASMs can cause serious rash that needs immediate treatment. If you know what to expect, then you're better prepared. Secondly, it's very important to take your medications at the same time each day and to space them out as equally as possible. Try to set up a routine so that it's easier to remember. For example, if you take your medication twice a day, it may be helpful to take them right before you brush your teeth every morning and right after dinner each night. Try to keep it consistent with the routine and evenly spaced. Also, if your pharmacy allows for automatic refills, take advantage of this feature so that you never run out or are late on refills. If your pharmacy doesn't offer this, make sure to call in approximately 10 days before running out. It's a good idea to refill a little earlier than when you need it, just in case the doctor needs to renew the prescription, the pharmacy needs to order more medications, or if you refill by mail. Now, speaking of pharmacies, try to stay with the same pharmacy each time so that they have a complete record of all the medications that you're taking, and check to see if there are any interacting medications. It's also beneficial to know your pharmacist so that they can help with any medication-related questions you may have. Lastly, when you pick up your medications, check the appearance of the pills or capsules prior to leaving. You can check for the color, the shape, and the imprint. Sometimes pharmacies may change the manufacturer of your medication. So even though it's the same drug and the same strength, the medication may look different. In most cases, this won't make a difference. But in rare cases, for some patients, it can lead to a different response. It's also good to check in case you receive the wrong medication altogether. Here is a list of don'ts for your medications. Don't stop taking your medications abruptly without contacting your doctor, as it may have serious consequences. If you have concerns about your medications, please talk to a healthcare professional so that they can address it appropriately. They will work with you to achieve the best outcome. Many ASMs need careful and gradual tapering of the dose to safely discontinue, so it's important that you get your doctor involved. Secondly, many supplements and over-the-counter medications can interact with your ASMs. Contact your doctor or pharmacist before starting any new medications, supplements, or over-the-counter drugs. Next, do not store your medications in the car or in the bathroom where the steam can interfere with the integrity of the medication. Doing this can decrease the quality of the medication and thus decrease the effectiveness of preventing seizures. It's better to store them in a cool, dry environment. Lastly, make sure to carefully check the expiration dates of the medications so that you don't take expired medications. Most medications that pharmacies dispense should have sufficient time to finish the bottle prior to the expiration date. But if you keep extra supply of your medication, if you have previous tablet strength left over, or if you have seizure rescue medications that are not regularly used, be mindful of the expiration date since expired medications can have decreased effectiveness. So we talked about the do's and don'ts of anti-seizure medications, but always remember that you don't have to do this alone. There is a team of pharmacists available and ready to help you. If you need help with your anti-seizure medications, please reach out to your doctor, nurses in your clinic, or even your neighborhood pharmacist. We pharmacists specialize in medication information and management. Some even have further training in epilepsy. You may find it especially beneficial to develop a close relationship with your neighborhood community pharmacist. They can give you important information about potential side effects of your medications. If you're taking multiple medications, either for seizures or for other conditions, sometimes the medications can interact with each other and cause changes in your treatment. Your pharmacist can help you manage those drug-to-drug interactions. If you ever see pharmacists during your clinic appointments, they can even provide you with further assistance, such as providing medication calendars and techniques to manage your side effects. Lastly, if you're ever thinking of starting an over-the-counter medication or supplement, you can consult your pharmacist to see if it will be safe. So thank you for tuning in to this video. And always remember the do's and don'ts of anti-seizure medications to get the most out of your treatment. And remember, you don't have to do this alone, as there are healthcare professionals ready to help you if you need.
Perfect. Thank you.